Welcome back to Fly on the Wall. And I'm Dr. Jerry Crete from Atlanta, Georgia, and I'm here with...
I'm Dr. Peter Malinowski from Indianapolis, Indiana. We are your hosts, and we have assembled an august body of Catholic clinicians that are joining us today. We're excited to have them. And so we'll have them introduce themselves. We'll start over here.
Dr. Andrew Sodergren with Ruah Wood Psychological Services in Cincinnati.
Dr. Matt McCall. I'm out in Denver. I work at Catholic Charities.
Dr. Mark Glafke of Glafke Psychological Services in Lafayette, Indiana.
Dr. Eric Adan of Integritas in Indianapolis, Indiana.
Dr. Peter Martin of Catholic Social Services in Lincoln, Nebraska.
Dr. John Cadwalder of Central Psychological Services, Indianapolis, Indiana.
And we're actually following up from our last one where we were discussing different issues of authority, boundary crossings, and various struggles for priests, for bishops within the church. And we were just wrapping up, or we were running out of time, when we got to the point where Dr. Sodergren mentioned, how about a solution? So,
yeah. Well, we had some solutions also coming from Dr. Martin near the end as well. So these guys have all agreed to fly back in, to take their spots again, and be able to present one more time. So really grateful to all of you. I'm very grateful to all of you, and I'm grateful to our audience that makes this all possible. And yeah, we're actually coming in with the solutions, what we think would help in these situations. So maybe we can just kind of briefly recap the problem, right? For those of us that may not have been at the last, viewed the last one. What were sort of the main themes that we brought up in terms of the problems that we were addressing in that last session?
Well, the very last thing we were talking about was that little case study,
correct,
right, of the good priest who gets ordained and gets overwhelmed with administrative tasks and gets disillusioned to some extent, and then he has a boundary violation with a parishioner who themselves is struggling in a bad marriage and this kind of thing. And so when a boundary violation happens, I think, Dr. Sodergren, you were asking, what's the church's responsibility? What should the church do?
Right. Yeah, because this whole issue of a boundary violation with an adult, it's not handled uniformly, and there's a lot of debate around what should the church's response be, and I thought that'd be a great thing for us to talk about. Because in my opinion, I think that in many times the church doesn't respond adequately either to the priest or to the victim, in this case a woman. And so I thought it'd be good to open that up and see what everyone's ideas are about how the church should respond to a scenario like that.
Seems to me the era of the cover-up has passed. There are some cases where you do need to be discreet, but to try to use euphemisms or keep everything hush-hush, I don't know how well that's going to work. Because the things get out. The parish does need to know, like, what happened? Why did Father so-and-so get pulled away all of a sudden? Right. Obviously not everything. You do want to preserve some privacy for the priest, but I think there is some prudence in just being open about what's going on.
I find that extremely rare.
Yeah, I don't know if it happens. So.
Yeah, and there's prudence for the woman in that case and her husband
sure.
and her children in that particular type of case. But I'm not sure that the church is open with those kind of things. Priests just go away for a while.
Right.
Is that a good idea, though?
No. Well, which part of it? I mean, the priest going away, or the parish not being told?
Just everything hush-hush,
No, the parish needs to know something, and obviously you have to exercise prudence around how much detail you disclose. But the most important thing there is not, maintaining an image, right? Mm-hmm. That is the last consideration. And the parish needs to know what happened if there's going to be any kind of trust in the hierarchy. I think that's important. We have to be able to, to a certain degree, call a spade a spade. When someone makes a mistake was happened. Here's how we're responding to it.
Doesn't necessarily mean the priest is a horrible priest or a horrible person at all.
Right.
But we don't have to hide anything.
Right.
Well, maybe what may be helpful would be like if we were trying to pretend that the diocese where this priest was operating at comes to us and says, hey, look, we have this individual, have these struggles, he needs help. And we're going to remove him from active ministry so he can address this issue, like what will we offer to them and say this is what we think would benefit him to help him sort of understand and overcome this issue, so there's healing there's understanding, and reducing the probability that it ever happens again. So I think we're talking a lot about like what the church should do in terms of response and governance, but like from our expertise, what could we offer to the church? Like this is what would help this soul, and for the family that was affected, and for the parishioners too, in terms of like having to navigate, like, you know, your father just is taken away. It's like, you know,
there's all this talk about parish as a family.
Yeah.
We're a big family. Like if something happens like that in my family, like my kid's going to know about what happened, right? You know, if I go away for 6 months, they're going to know why,
right?
You know.
Well, one thing that we should probably make clear, first of all, that we've already touched on several times, is that the priest probably should go away for a period of time. Right? We shouldn't just take that for granted. Like, with that, I think that just needs to be said, right? But going away for a specific purpose, and that is to get help.
Right, not to be shoved somewhere else that people don't know the issue, but it's
exactly
to deal with it.
Not to do damage control and hope this goes away, and not even in the first instance to be punitive towards the priest, but he needs to be removed from the situation because he's done harm, so that healing can occur here. But he also needs healing. Right, and so that needs to be taken seriously, and that needs to be done outside of ministry for some period of time.
So in the case of, let me get a sense, because I'm not sure I'm understanding like what's the gravity here, right? Because we talked about all kinds of different kinds of boundary violations. So like, what are you thinking about when you're saying that? Because spending 2 minutes too long talking to a woman in the back of the church doesn't mean that we have to remove the priest, right?
Correct. So the scenario I have in mind, based on Dr. Creet's hypothetical case example, is that this emotional relationship has grown to the point where now there has been a clear sexual boundary violation.
Sexual boundary violation. Okay.
So I'm talking about, you know, there's been a sexual indiscretion between a parish priest and a parishioner. Right? In that case, I think the priest always needs to go away for some period of time for treatment, and we can talk about what that might entail, that healing process. But even after that, there needs to be ongoing, you know, some kind of ongoing accompaniment and follow up to make sure that he's continuing to put into place some kind of treatment plan or whatever to make sure that this kind of thing, you know, never occurs again.
By the way, I have seen that happen a fair bit.
Good.
So I do think that does happen, and I think it isn't publicized. I think it is usually handled with tons of discretion. I don't see, though, it being named why the priest was away. Like I don't hear the parish learning, oh, he had an affair or something like that.
Yeah, because I think that's a critical point, because like people are going to want to find out who it was, right? You know, that's a real critical thing right there.
And they'll know because they'll have seen people together, and then people start gossiping and all kinds of things. So I'm not actually convinced that the parish needs to know the details. Yeah. But I'm on the fence. Like I'm trying to understand, well, what needs to be communicated. Right. Because I do think it causes a lot of problems if you would to announce something like that. Yeah. There's.
On the other hand, not saying anything just leaves it open for speculation.
Yeah.
Right.
And then you can come up with any solution. The gossip doesn't stop, it actually gets even more so.
So I think one of the things that we can do is actually serve in consulting roles to the hierarchy on this kind of thing, because I think these cases have to be handled not with a one-size-fits-all types of solution, right? But with thoughtfulness and consideration of the psychological and human elements, you know, in addition to the spiritual elements, that we could actually be helpful on in some of these ways. Thinking of this as a system, you know, thinking of this in terms of its impact, because a lot of times I think those kinds of considerations just don't enter into the calculus when diocesan officials are making these calls. Maybe I'm wrong, but I mean I've seen a lot of cases in which it doesn't look like it was handled well at all.
Right.
And in some cases, you might have the same priest having multiple inappropriate, even let's just say emotional relationships. And so you have a lot of people become very dependent on that person. And then in one situation, there's a sexual violation, he's whisked away, nobody says why, and all these people feel abandoned.
That's right, yes.
I've also seen situations where there has been a response from the parish and diocese where a priest is removed from ministry. They're sent to a treatment facility 3 weeks or a month or longer, and then they're just allowed back in. And I think and I've seen with those cases, there's a recidivism, like they end up acting out again in an inappropriate relationship, and so something was missing in terms of like the assessment of after the treatment program and following them. It's just like, well, there is no perfect time window of how much time someone should be away. It's like, I don't think we're doing a good enough job of assessing what happens.
Well, I think that kind of a sexual boundary violation is a huge event in a priest's life. I mean, it's a major breaking of the vows that he makes. Where is he in his spiritual life? What are his relationships like? Is he going to be emotionally prepared to go back into ministry right away? I think that all needs to be taken really seriously.
Well, I'm sure people listening to this are probably thinking like, hey, if there's a priest who's had any sexually boundary issue, they're like, we don't have a discussion here. Like, he should never come back. I mean, what would we say to them? Like, is there...
Ooh, that's a really good point.
Yeah.
That was the old norm,
Right.
rather than it was always it was only exercised when you wanted it to be exercised, but that was technically
Right.
Before we dive in, I just wanted to say something. I was reflecting a lot about like how much disclosure a diocese might consider doing in terms of these issues. And part of me feels uncomfortable even going there fully without a priest or someone that's done this kind of work in a diocese. And so we're kind of looking from the outside in. And so I just want to put that caveat out there. I think we should still talk about it, but I think I want to put that caveat. The other thing I would say is that if you're not specific enough, if you just say, hey, Father Joe is going to be out for 3 months, he's going to get some help for X, Y, or Z. If you're not specific enough, and let's say it is depression, let's say it is a debilitating depression or alcohol or something like that, everybody's mind is now going to turn to, he crossed some sexual boundaries. And that's a disservice to him, to that priest,
Yes.
because of the situation now. I think the general kind of mindset, and I'm sure people for us in this room too, that mindset is, it's because he crossed sexual boundaries. That's unfair to him. So I think there has to be some level of clarity to, but ultimately not identify victims and stuff, because I think that has to be first and foremost. But then, I don't think it's a clear-cut kind of decision process right now.
And one thing I want to emphasize in all of this is no lying. Don't lie to the people about it.
Right.
Really. I mean, again, I think we need to say this
Yes.
clearly and loudly and distinctly. Do not misrepresent what is actually going on. I would rather have silence than misrepresentation. So yeah. I mean, I'm envisioning, even as you were talking, Dr. Martin, like bringing the priest in. How can we get your thoughts about how to handle this? Actually working with, the priest, working separately with also the person involved, right? To see where that person is, right? Like actually trying to, like, think about this, in a deeper way.
I'm curious who's doing that. Like who has that role to do it? Because that sounds wonderful. Who does that?
Vicar of the clergy.
Vicar for clergy. That's where it would fall under in a diocese.
I speak in ignorance, but my assumption is that there's too much fear in the church to do something that healthy. Because if we actually want, what I mean is,
that's an indictment.
We're going to bring in this sense, we're going to try and see how we can support both for common good. I think the fear is if we meddle too much, we may get sued.
Right.
Or we're going to have like this kind of, in the sense of it, let's just leave them alone. We'll give them care, whatever we can do.
But you get sued when there's a deep sense of injustice.
Sure.
That's when you get sued.
Well, but it's a duplicitous aspect of where we as the church, as the body of Christ, what do we stand for?
So here's my thought on that, Vicar, though, because at least from a victim's perspective, this was a violation done by a priest, and you're going to have another priest come in and be the mediator for that healing process.
Right.
That trust is already gone.
Right.
And they're not, you know what I mean? And this is part of the bigger systemic problem, is that now I think it's going to have to change, because there's a sense in which clergy, episcopate to some extent, has lost their moral authority. even a sense that they can even be good pastors and good facilitators and good mediators and fair about it. So now we're expecting this person to come in.
Right.
You know,
That's a good point.
I mean, that's a really...
It's more the sense of bringing a laity or some other kind of expert that can be helpful in a different kind of way. Even the sense of mediation, maybe one way of saying it.
Yeah.
Yeah,
And
I was seeing more of a team approach, not that the
Right.
vicar for clergy was going to do this all by himself.
right.
Yeah.
Right.
Yeah.
Yeah. And I think the victim should have an option at least on that. Like for
Oh, for
instance,
sure.
you have some individuals that have had these violations take place, and they might be more perfectly fine going to someone with a collar to discuss this. But others, because of what happened, there's no way that they would be open to that. So you want to have options available to them.
You don't want to re-victimize the victim by
Right.
trying to do
Yes.
something,
Right.
which is
Well,
that's
and
very
unfortunately,
important.
that
Right.
sometimes happens when you have a vulnerable adult who comes forward and they're treated coldly, maybe disbelieved, or just not handled very sensitively at all. Often by a person with a collar, it's just another
There's
trauma.
still a lot of the attitude of why didn't you just say no? Like you
Yeah.
were in this too,
Right.
you know,
Right.
and not recognizing those
Right.
power differentials that
Exactly.
are extremely powerful.
Right, or just sort of resenting this person coming forward because now this is a problem I have to deal with.
Right.
Right, and obviously that does a huge disservice and re-wounds the victim.
I do think there are many good therapists and counselors and so on that actually would fit that. Could potentially fit that role.
Yeah.
To be that mediator person between,
Yeah.
the people that have been harmed, the priests themselves, help the church and help with that process.
But I wonder, even as far as, kind of back to the earlier point that some of you discussed, there is kind of this mentality among the laity of where the kidnapper van comes and the priest is taken away. Father didn't have morning mass today. He always did daily mass. And then it's Tuesday and Wednesday. Suddenly, it's gone on for weeks. And then all of a sudden somebody sees him at Kroger. He kind of reemerges back into society. And it's kind of where, whether he's reassigned or not, there isn't this sense. What I wonder is a couple things. Certainly the laity and how that affects him, how much they need to know and not. We kind of touched on that. But I wonder, as the priest is almost having this sense of reentry, what is the level of care that he's receiving? Is it, he's gone to the inpatient facility and said that,
Signed
stamp
off
him,
on
he's
it,
good enough to go? But even if that is true, who's making that decision of trusting that as being true? But how do we help even provide for that care to continue it when they come back, before they even re-enter ministry, once they're kind of back in whatever respective diocese or community? So it's not just, we know we've gone through this and they seem to have grown. Maybe they need to kind of slow ease into it, because we're not even considering the priest standpoint. Father Malinowski's been gone for 6 months, and now all of a sudden he's saying, Mass, are you okay? We're really praying for you. And then they get frightened.
It's all awkward.
Well, and I think it's really more the sense of fear, like from an attachment standpoint. Like you said, Dad is suddenly gone. Now he's back. Is it okay? Is it safe? Or, really, what do I trust?
I knew a situation, and this is not any client of mine, and it's somewhere far away, of a priest who actually embezzled funds because he had a gambling addiction. And he was beloved, very charismatic priest. And he went into recovery. He went to jail, I believe. He went into recovery, and he re-entered, and was very open about what he had done and how, and the change that he had had and everything. He was well received, actually, back, from my understanding. If I'm wrong on any details of that particular case, I'm sorry, but it was, to me, I remember thinking, wow, that was powerful. And yet, but we don't do that with sexual sins, right? Because that's too much of a stigma, right? There might be other issues. Alcoholism, probably not either, but I think that's the other one they think of. It's a sexual indiscretion, or he's being sent to guest house or somewhere for alcohol treatment. And that's just the assumption.
Right.
Could he come back and say, hey, yeah, I was on treatment because I had this problem? And personally, I feel like, we were talking about heroes last time, I feel like that's a heroic thing to do. For for the priest to actually say, hey, I'm human too. I had a problem. Hey, the diocese actually supported me to get treatment and help. And I got that. These are the ways I've been growing and changing, and I'm back. And I'm sorry.
And I
have ongoing care.
Right.
I have a continued care plan, and I'm seeing a therapist, and I'm working with a group of priests that are also supporting me, and I'm doing all right. And I think any priest that's listening is going, oh, that sounds like terror, right? To do that. But wow, that's that family. That's where we're actually, the church is that field ambulance or whatever. That the church is a place of healing.
It's being
and
penitent
growth
too,
and honest and penitent,
Yeah.
and he's modeling
Right.
in that case
Right.
for his people who are probably going to say, "Hey, let's be more real
Yeah.
about our problems."
Right, because there's tons of families that he's going to minister to. You have broken marriages, right? And so it's a good model for them to even despite those horrible wounds, that there can be healing and actually a better relationship after the wound if both parties are obviously using their free will and love of one another. And that's a good modeling of the priest being able to do that in his own life.
Yeah, I like that on many levels. So the first one is, if I have some issues that require immediate attention and maybe sending me away or something, I'm probably going to disclose them a little differently to my 4-year-old than my 20-year-old. Right.
Mm-hmm.
When you're dealing with this stuff in a parish, you think about a priest as a father, so spiritual father to their parishioners. It seems like since you're dealing with adults, you probably should give more specificity because people are going to be concerned. I mean, it just seems like they, in some ways, deserve that, right? So that makes a lot of sense to me. I'm thinking of a bishop who had to leave to getting some treatment. And was very specific about what it was that he was getting treated for. So I thought it was wonderful on many levels. Number one, because that way it clarified what he wasn't getting treated for, right? Which people, again, their minds go specifically to sex or addiction. But the other thing it did is it provided a role model to the individuals that in that parish that probably could use some treatment too, but maybe were hesitant to do it. But now because their shepherd, their leader, their father figure was doing it, maybe that opened some doors for them and allowed them to go past that resistance to it. And I thought it was beautiful. And hopefully when the bishop, or if the bishop returns, he'll be very clear about what he did and how he improved, and that will also be a great example to the diocese.
I like that better than the diocese issuing a statement about his problem.
The problem is that it takes a lot of strength on the bishop's part or on the priest's part to be able to be open like that and to humbly, share what he's struggling with without a ton of shame flooding in. I think that's ideal, and I really admire it when people do that, but not every priest has that inside of them.
I wonder if they should be encouraged, though, by their spiritual director or superior, whomever, to be challenged, because, that's really a humble heart, and that's a deeper love.
Yeah.
Not only love, of parish or community, but also of God.
I think one of the issues that we've kind of touched on a little bit is the need for ongoing follow-up and care after a priest has gone away. There's sort of the acute phase, but there's got to be ongoing accompaniment. And that includes mental health services, but the diocese needs to be involved with that, whether that's the vicar of clergy or somebody else. They need to be following, and meeting regularly to know, how's it going? Are you going to therapy? Any issues? Ongoing mentoring, not just in a policing way, but more like fatherly accompaniment. And I don't think that's done hardly anywhere. And that's to me, that's a kind of a big hole that needs to be filled.
And I think it needs to be preventative, not just a response.
Yes,
and
agreed.
It's widespread, because there isn't a person, or maybe there's one or two, I don't know, but there isn't a person who's not capable of making a really bad mistake under certain circumstances.
Agreed.
In this room included. Yeah. Absolutely.
Yeah.
Especially that half over there.
Which is it more leaning towards this way?
It's just the couch.
It's just people.
No, but it's absolutely
Assigned
it's a
seating.
great point, Jerry. I agree completely.
Yeah.
I have seen and heard of some of that where, priests will kind of come back and begin working with therapists. And I think that's excellent, because that's really a deeper level of care the bishop's trying to provide. Having worked with different kinds of priests in different situations, some of what's tough about that, though, is also the fear as far as, seeking voluntarily, or are they just required to come? It's kind of like almost where, and I say this to people in general, whenever they're referred by a spiritual director or parents or whomever, are you here on your own accord? Are you just, am I like your probation officer?
Right.
So, you're really, it's not being obedient, you're just being compliant.
Right.
Is your heart really in this, in the sense there's some good that can actually occur here and some healing?
And I think we have the responsibility there, because even if that is their mindset, right? Okay, I'm being required to go to counseling or something. It's our job to then create a rapport our bill. Try. I mean, we can't. We're not fully responsible. It's a two-way thing.
Yeah.
But I'm just saying, it is. We have to take the responsibility to say no. We have to create an environment of safety and rapport, and to invite them into something new. Right. Ideally, if they're coming back from a treatment center, one would like to believe that process has already begun.
Right.
Yeah, because
It
a lot
may
of
not
times,
be.
they really don't understand what therapy is like. They don't really understand like what would actually happen. They've got misconceptions about it that make it more threatening or whatever.
Part of our responsibility is being assessed, like if we're the ones treating, is giving an assessment and feedback to the diocese of where that person's at in terms of their understanding of the issue, their acceptance of it, and their willingness to make changes. Because there's some that are kind of like, well, they realize what they did was viewed as wrong or is wrong, and they'll have a commitment to try and avoid that behavior. But you're not really sensing it, that they're really like getting the gravity of it and how this is actually not only impactful for the victims but for their own souls moving forward.
Right.
And I think we have a responsibility as best we can to assess like where they're at, acceptance, willingness to change, and the gravity of that.
Yeah.
Yeah, we see him. You see people in very different situations. A guy gets caught in an affair, stops the affair, and can this all just go away now? Rather than looking for improving the situation, to improve his marriage, and rebuild the
Really
trust.
understanding what led to this,
Yes. Right.
and how do I need to change, or how does my life need to change to make sure that I don't fall in that way again.
Yeah.
and so
I've been in
forth.
that probation officer therapy before, and
Yeah.
it's a frustrating process.
It is,
You can have some.
But to be fair, I do get that obviously a priest, it's a different role, right? Office and everything and responsibility. But if a guy has an affair, like one affair, we're not talking about a guy maybe who's chronically, but we don't send him away to 9 months or 6 months of treatment.
No.
We just don't.
Yeah.
And yet we work on the marriage, and maybe the marriage won't work for whatever reason, but we do try to work on the marriage typically.
But I do think that primary intervention or preventative approach, where they say an ounce in prevention is like worth a pound of whatever later on. Or dollar versus 100. I don't know where it's at. And maybe in the church it might be $1 versus a million. If you think about I just read there's 20 dioceses now in the United States that have filed for bankruptcy, primarily related to this issue. So. From a dollar standpoint, or just from a human standpoint, I think the church spends a lot of time, to their credit, spends a lot of time on spiritual formation after, let's say, they've been ordained, and say they have a spiritual director or someone they can turn to. I think that ongoing human formation is going to be essential for prevention, and this is where, not to beat a drum, but I do think there needs to be the accompaniment model. I would like to see it more in a formally supported approach where actually they do meet with individuals that focus on the human formation, not necessarily to the exclusion of spiritual, but a lot of times I find spiritual direction can turn into kind of a low-level psychology, unfortunately, because they've got all this other issues.
Right,
that's what they need.
is.
That's what they need. It would be nice if they could have something set up formally in the structure before they leave with an individual, maybe in their diocese or whatever that the diocese respects and can be supportive, that does provide the human formation so that when they get to spiritual direction or formation, now we're talking about transcendent things. I'm not talking about low-level psychology and I don't know what I'm doing. But to be able to form, these priests that are already in the diocese that are established on how to address those natural level things at a better level.
Yes.
And it's a very intimate relationship where you can be real, where you can feel safe enough to disclose, where you can open up about those dark areas of life that they're not comfortable opening about, and then maybe they spiritualize it too much because that's what they know. We've got to get to. I think we're at a point.
Yeah, if you don't mind me adding, it's something you and also Dr. Sodergren said too. So, priests are strongly encouraged, to have a spiritual director and typically meet with their director once a month. I like the idea of, maybe a lay couple or someone in the community who you would have to have some sense of vetting process of accompaniment. Are they healthy enough to be able to handle this? Right. Kind of jokingly, knowing how the sausage is made, it's tough. We're privy to things which are really hard, right? I would argue, though, that if we're going to encourage the spiritual development, why not require, in the sense of health, that priests go to therapy at least once a month?
Yeah. See, I had a similar idea, John, and that was the idea of, typically they're encouraged to have a yearly physical, why not a yearly psychological as well, where they're coming in, and we wouldn't do a whole battery, but do a clinical interview, maybe a couple symptom checklists, and at least check in on them. And then as we do that over time, you hopefully you'll be able to flag some things if you guys starting to go downhill. And at least they've already got a relationship, if there are issues that come up, and it gives us a chance to make recommendations.
Well, and I think within that, we'd have to have it, and being respectful of the priests, that we're not, is kind of just an extension of the bishop's will.
Right.
So we're not basically here to be a narc and tell on you. This would have to be a private relationship, right? I mean, confidentiality, same as we provide anyone, with certain kinds of exceptions, right? Some of the specific boundary violations we talked about. But the sense of where, the work that I do with seminarians, and I kind of say this, jokingly but seriously, see me now, see me later, you'll come see me. But I mean, the point that I try and impress upon them is there is nobody in the room who can't benefit from growing.
Right.
So, I mean, you can let your pride get in the way and say that I am perfectly psychologically healthy and I have nothing I can do to improve or to grow. It's just kind of laughable.
Some of this lands on us too, though, because there are plenty in our field that have done things that have led to suspicion by members in the church.
Absolutely.
I mean, so it's understandable that there might be a jaundiced eye, looked at us, but that's part of what we're trying to do with the Catholic Psychotherapy Association. That's part of what we're trying to do with Souls and Hearts. That's part of what we're trying to do, with even this show is, to actually participate in the professional formation and the human formation of enough therapists to be able to help with this.
Yeah, it's a very particular therapist who a priest could go to and really trust and really be helped by. Yes. And I think that priests are right to be skeptical of your average counselor.
I agree.
It would be really hard for a priest to just go to anybody.
I'm skeptical of an average
priest.
A lot of counselors are hesitant to work with clergy.
Sure.
I think we're real squeamish because there's a sense of every soul is equal, but it's wow, the gravity of I'm working with Father and I need to help him, and if I don't, then I'm going to feel this sense of guilt.
Yes.
I haven't helped him in his life and the souls, or potential future victims, and some people just didn't want to get near it.
So, especially early in their career,
right? So we have to be courageous to be able to get supervision.
That. I remember the first couple times I saw priests and clergy, or priests in therapy. I was not my normal self. I was much more nervous and kind of trying to overthink things, and it's difficult to really get the therapy going. And I think a lot of that was really my issue. I had to get over the fact that this is a priest and learn to see them just as another fallen human being who needs psychological care.
And I think we need to appreciate that the chanceries, the diocesan personnel have often run across therapists that have not been effective, in the work, have fleeced them financially,
yeah, for sure,
have caused all kinds of problems, in various ways, and so I think we also need to be mindful of that when we're engaged in that. And I think we also have to be really clear about who the client is, especially when we're working with priests, right? Because if the client is the priest, that's very different than if the client is the diocese, because then you've got entirely different sets of responsibilities. Right? And I think a lot of times we have to be really clear about what we're doing so that the diocese doesn't just believe that if we're doing individual therapy with the priest that they just have access to all of that. Because they don't, even if they're paying for it.
Yes, and I've experienced that with religious orders too, right? Where they maybe have someone in formation or somebody like that they want to come and do therapy, but then they also essentially want to have an evaluation of his progress and this and this and this, and it's we got to clarify roles here. Right. Am I really here to do therapy, or am I here to
evaluate?
Exactly.
And I've seen both ways. I have seen religious order wanting too much information and needing pushback, and other religious orders who are much more gracious. And if you've earned their trust.
I want to go back to one thing if we have time.
A couple minutes.
Okay, and that is one thing that we haven't, I think, addressed enough is what should be done for the victim in one of these situations.
I was just thinking the exact same thing, because we got to, and that may be, is that another show?
You're the host.
I think I'd say something. I have seen situations where the victims were given counseling, were given support, and this kind of thing. So I do think some good things do happen. I think maybe there's been some change, like if it's an adult victim.
Yeah.
We're talking about. But it's a tricky one. And especially, like, let's say in that case study that we were using before, let's say the woman worked for the church in some capacity. Now all of a sudden you've got a possible sexual harassment case.
Right.
That could be a whole other, we get into that.
Complicates
But it
things.
creates, those kind of things do happen commonly enough. And so, unfortunately, and so it creates a whole other level of, we have to have distance from you legally, and all this kind of thing.
Yeah. But it seems to me that one of the first and foremost considerations is providing safety and support for the victim. That includes, who's available to hear their story, the mediation that we talked about earlier, making sure they have good care, supporting them in any way that's appropriate. I just think that's really vital and needs to be emphasized.
Because that person, in that case, could get vilified by the community.
Absolutely.
And often
Would.
often would,
Yeah.
often do. And some of them are terrified of that,
Yeah.
Because the idealized priest, often very charismatic, is lost, right? You've taken away our priest.
You seduced him.
It's seduced him. Yeah, there's a lot of accusations along that. Because again, the priest is more important to that parishioner that's idealizing the priest than the victim, who can be perceived as just disposable.
Right.
I will say I see a lot of younger priests that are open to that don't have major issues, like not big giant issues, but they're open to therapy exactly for what you guys were saying about growth.
Yeah.
Yes.
Right?
I've experienced that too.
They just now, that's just part of the norm.
Yeah.
And I think our society is starting to see that counseling and therapy can be a normative thing. And I'll say one last thing is group counseling in some process. Because that's kind of what we've done.
Right.
Right? Just, and without having to. And because we realize we're better off if we support each other.
Yeah.
Right?
Yeah.
And I think that would be a great culture shift.
Yes.
If priests
Yeah.
could do the same.
I would love to see a robust system of priest support groups.
Yeah.
I think that would be a really a great strength for them, a resource for them.
That is something that I recommend all the time for therapists, is that we be in our own therapy, that we be really focused on our own human formation. And for
that
those
sounds like another topic. For another maybe.
Well, we did that topic already in some ways, though.
Oh, okay.
Yeah, number 3.
Oh, okay.
Yeah, so we can do it.
That was self-care.
You can recycle
Yeah.
time.
Self-care.
Yeah,
It's
that's
a little bit more involved in terms of
In terms of therapy, well, we can do that one. Yeah. Oh, you think so?
Therapists in therapy.
Therapists in therapy.
And I will say, just to kind of the model, right? I know we're kind of crunched against time here. Time is our enemy, but I know of religious orders that are using the accompaniment model early on. Like they're literally, this is not just for marriage preparation, where they do the accompaniment and they find a mentor couple that's 5 years married and they've been in the trenches and they're active in their parish, and that kind of helps to figure out who's a good mentor couple. But they're using this for people that are novices in their religious order. And so they're getting that human formation. They're getting that kind of intimacy and, let's say, attachment needs met and so forth. And so when they go to spiritual direction, what they are getting is a more robust spiritual direction as opposed to human formation issue. And I do think that's, and there are seminaries now that do have growth counseling. And so you'll go to like a group, a support group, or you'll go for individual counseling, it's growth counseling. But if you get diagnosed with something, then you're sent to a clinic and you're actually working with an individual therapist. So there are models out there right now, which I would highly recommend. And I think those are kind of, I don't know if I'd say flagship, but they are in some ways beacons out there that can provide some support that these guys need and women need in their formation.
Good point. Thank you. And thank you all.
Thank you all.
Absolutely. All right, till next time, be still.
Believe.
Be loved.
Take good care.